My name is Pamela Were. I work with the International Cancer Institute, which is not a not-for-profit organization whose aim is to improve access to cancer care in the sub-Saharan Africa, mentorship and clinical research. It is also a designated site for ESMO, that is European Society for Clinical Oncology, co-mandates education, training, clinical care, research and development, and advocacy. ICI approach to care involves survivorship, leadership and partnership, education and training, community screening, optimal diagnosis, access to therapies, ICT, and data. In Kenya, 42,000 cancer cases are diagnosed annually, and approximately 27,000 of them die. And remember, with a population of 54 million, we have less than 100 cancer specialists who are located in major towns. And this leaves patients in rural hardship areas with lack of oncological services. The outbreak of COVID-19 pandemic negatively impacted on cancer care, whereby it caused fear of traveling, messages for patients to avoid hospitals, and lack of transport and food, reduced economic activities and closure of health facilities, whereby even some health workers were infected, reducing the workload. Quality of cancer care provided should not be determined by the patient's geographic location, and every cancer patient deserves optimal care achieved through timely diagnosis and treatment. Accessibility to affordable cancer medication is essential in achieving optimal care, and ICI utilized integrated innovative approaches to improve cancer care and access during COVID-19 outbreak. ICI had been conducting community-based screening, whereby patients would be screened in churches, stadiums, and schools, but this would not be achieved. And this is the sample of the screening activities. So such number would be screened, and some of the clients presenting during these screenings are like these patients who only come for confirmation of diagnosis. And innovative approaches that ICI has been using is worked together with the partners, whereby we have teleconsults, multidisciplinary tumor boards, virtual cancer training, skills training, mentorship, revolving fund pharmacy, and the rest. In teleconsults, more than 2,000 phone and video consults were made, and ICI has a rich pool of consultants who are drawn across the sub-Saharan Africa. The VTB participants were as shown in the chart, and were led by PharmTechs and tailing our pharmacies because of their less numbers. This is a sample of teleconsult through a video in one of our clinics. Survivorship meetings were also not left behind, and ICI ensured that survivors also were met and their psychological issues addressed. One of our clinics in Maskweni saw a swelling number of cancer patients because when the main city was closed down, patients went to Maskweni, and they all attended because ICI staff would travel there. Virtual preceptorship in ICI is in two cohorts, clinical preceptorships and non-clinical preceptorships as listed there. And we had many, many people attending from the entire sub-Saharan Africa. The geographical scope is as shown in the map, whereby people were drawn from different counties. The faculty distribution per country is as shown in the bars. We had faculty from Kenya, US, Ethiopia, and the rest. Cadres of healthcare providers trained were GPs, clinicians, nurses, lab techs, data, pharmacists, and allied workers as shown in the bar charts. And this is one of the sample clinics that are opened in the peripheral facilities under the Empower collaboration. On-job trainings were not left out, and our faculty went there, and revolving funds pharmacy, also whereby we exchange vial to vial, and the return when they have there. And fully embracing and adopting technology can have a massive impact in cancer care, especially in LMIC. With a trained HCP in basic cancer care, patients are able to access and continue with their care, which is timely and cost-effective. More trainings are needed, especially for practicing clinicians. And this example of ICI can be adapted. And those are my acknowledgements. So thank you.